So the next thing we're going to talk about is the chest seal that came in the OTAC Primus kit, or placed in our IFAC. And this one is it's called a Hyfin vent, and pretty nice piece of equipment. It's nice and compact, so we're fitting it in there pretty well. Now, when we talk about the reason why we have this is pretty simple. When you're breathing in and out, your lungs need a negative pressure area to breathe in. So if we make a hole in the chest or in the chest wall or in the back part of your thoracic area, we're now adding a positive pressure to the body, or positive pressure to that space, and it's going to slowly squeeze down on our lungs and make it so that we have a collapsed lung, if you will. So that's why we're going to do this, because we're going to stop that air from entering in, and a matter of fact, we're going to change that a little bit, and we're going to help push that air out with this kit. So this kit is very user friendly. If you see right here, it tells you step by step how to use this and what's going to be inside here. Now, if you happily can't read that by chance, we're going to flip that over, and it's going to give you directions via pictures. And I like pictures. Pictures seem to help me a lot. So let's talk a little bit about why we would use this, or in what instance. We talked a little bit about gunshot wounds, but it doesn't necessarily need to just be a gunshot wound. If for some reason we have maybe a stabbing, or we get punctured by something, or impaled by something, that's when we're going to use this. Now, I can tell you, in the EMS side of this, we're going to be placing one of these on anywhere from the belly button all the way up to the neck. So if there's a wound inside there, we're going to throw one of these on there. You're not going to hurt anything by placing one of these on a wound if it's not what you would call a sucking chest wound, or a wound that would need it, but it's great. You can still use it on somebody if for some reason they get impaled or shot or stabbed in the thoracic area. This one's already been pre-opened a little bit, so we're just going to go ahead and take it out. And I will say, if you do happen to get one of these, make sure you kind of keep a clean area around you so you can practice with it, because this is a pretty stressful situation if you're going to be placing this on somebody, because you probably will be saving their life if you happen to have to do one of these. So practice with it. It's much like our tourniquet. We want to practice with it so we're proficient, and it's muscle memory when we're actually using it, not having to think about it. So this says wipe away the dirt and fluid from the skin with gauze. So we're going to pull this out, and it comes with a little piece of gauze, and it's clean. Now, so we talk about some things about being aseptic, or basically clean like you would get in a hospital. These are really just clean. There shouldn't be any contaminants on it or anything. So much like a bandage, like a 5x9 is what we're going to have in here. So we're going to clean that portion of wherever that wound is. We're going to clean it off and try to dry it as much as possible. And then we're going to open this up. Now, this piece right here is super sticky, which is good because it's going to stick even if there is fluids that are around. It says grip the red tab and peel it away. Now, this stuff is almost like the stickiness of a mouse trap. It's that same type of glue. So if you do put it on something, it's going to stick. I mean, you can see it's already stuck to my finger. You know, I didn't even put any pressure on it at all. So what we're going to do with this is we're going to find that injury spot, and as you can see, there's a couple little channels right here. We're going to try to put that hole or puncture wound right in the center of that, and I'm just going to place it back on top of this piece of plastic because I want to practice with it some more in the future and make it my training device, if you will. And so we're going to find that. We're going to say, hey, our center of our hole is going to be right there. So we've already cleaned it off. And I'm just going to push right down, and it's going to probably hurt whoever you're putting on here. And make sure I put it on there nice and straight here. And we're going to put it on there, and then we're going to flatten out the edges of it, and it'll stick right to it. Now, when I was talking about the negative and positive pressure, basically what's going to happen now is the air that's in that thoracic space is now going to basically burp out of these little channels, and no air is going to come back into it. So we're going to continue to make that negative pressure space inside the chest and keep that lung from collapsing. So basically saving that person's life, whoever that would put this on. And we'll do this on the front. and it does come with the second one. We're going to put this on the back as well. But this is the Hyfin vent, a chest seal, a great piece of equipment. Make sure you practice with it so you know how to use it and become proficient with it.